have the ascending aorta, the arch of the aorta, the descending aorta. Now coming off of the arch of the aorta, as you know, you have the brachiocephalic trunk, the left common carotid, and the left subclavian. Left subclavian is heading towards the clavicle. You go under the clavicle, become the subclavian, and head towards the armpit, not shown here, to become the axillary. We'll go to that afterwards. Now here you have the descending aorta, thoracic. These are the intercostal arteries and intercostal veins. This is the hemiazacus here in blue. Continuing down with the thoracic aorta, it goes through the diaphragm, which is the principal muscle of respiration, and become the abdominal aorta. The abdominal aorta gives rise to the celiac trunk right here, which supplies the left gastric, splenic, and common hepatic. Left gastric, splenic, common hepatic. Inferior to that is the superior mesenteric, the inferior mesenteric, the left common iliac, the right common iliac, the right external iliac, the right internal iliac, the left external iliac, the left internal iliac, and if you follow this external iliac, it becomes the femoral artery over here. Left renal artery, left renal vein. Okay, so here we left off with the left subclavian, here's the clavicle, left subclavian, axillary, brachial artery. The brachial artery is going to split to become the radial artery, and the ulnar artery, and then the palmar arch. Right, here we have the lower limb. It's the left lower limb. So you have the left common iliac, left external iliac, left internal iliac. The left external iliac is going to become the femoral artery. Femoral artery is going to course posteriorly become the popliteal artery. It remains behind the tibia to become the posterior tibial artery. Here, the vessel is coursing towards the anterior to become the anterior tibial artery. Here, we have a vessel coursing towards the fibular to become the perineal artery. Inside the brain, you have the spinal cord, you have the vertebrals, and these vertebral arteries join to become the vascular artery, and the first division here is the posterior cerebella, and then it gives rise to the posterior cerebral, which attaches to this very, very skinny posterior communicating, internal carotid. The anterior communicating are not shown on this model. Looking at the superior mesenteric and the inferior mesenteric. Superior mesenteric, inferior mesenteric. Superior mesenteric gives rise to the right colic, the ileocolic, and the intestinals, and the inferior mesenteric gives rise to the left colic, the sigmoid artery, and the superior rectal artery. Superior mesenteric, inferior mesenteric, superior mesenteric, inferior mesenteric, superior mesenteric, inferior mesenteric.